Hi, so this is my part two for treating a skin cancer patient. So I'm just going to summarize what I wrote for my part one. So first, I will start by greeting the patient, and I wrote, "Hi, how are we doing today? My name is Haley, and I'll be your nurse for the procedure this evening." And then I'll ask her if she has any questions before getting started. And then I'll go on to explain the procedure steps and the goals of Mohs surgery. So I wrote, the procedure we will perform on you today is called Mohs surgery. It's a minimal invasive surgery that is going to be performed on your zygomatic bone, which is your cheekbone, to remove the basal cell carcinoma completely. The first step is your surgeon, Dr. Kavar, will examine the surgical area and mark some spots with a pin. Next, you'll inject the site with local anesthesia that will numb the area completely. You shouldn't feel a thing. And then next, you'll use a scalpel to remove the first layer of the tissue and send it to a lab to get it thoroughly looked at under a microscope. After she removes the first layer, you will be bandaged up and will cover the wound temporarily, and you will be sent to the waiting room to wait for the lab results. Next, Dr. Kavar will map out what she will be removing on your second round of surgery. She will repeat the steps of removing more of the margins, which is the edges of the tissue, reviewing the sample under the microscope, and performing the next round of surgery until you are cancer-free. After Dr. Kavar is finished, she will see if your wound qualifies for a skin graft, and then stitch you up and cover the wound with some gauze. The cancer we are removing today is called basal cell carcinoma. It is a tumor rising from the epidermis, which is the first layer of the skin. And basal cell carcinoma usually stays localized unless treated, so it's a good thing that you are here today. And then I'll ask her if she has any questions or concerns before moving forward. So then I would talk about the characteristics of the basal cell carcinoma. And it is a small white or flesh-colored bump that grows very slowly and may bleed. They usually form in areas exposed to the sun a lot, and they are the most common form of skin cancer, but the least malignant, meaning it's not very aggressive. So then I'll explain who the surgeon is and the tools being used for Mohs surgery. So I wrote, Dr. Kavar is a great surgeon who has earned her MD and has been specially trained in performing Mohs surgery, and been studying pathology, which is the studies of the cause and effects of disease, and reconstructive surgery. Dr. Kavar will be using simple equipment to complete Mohs surgery, including a scalpel, scissors, gauze, forceps, and an electrical surgical device for coagulation, which is the prevention of clotting. And then I'll ask her if she has any questions or concerns about the tools being used before moving forward. So then I'll explain the time of the surgery and the risk of scarring. So I wrote, the time of the surgery will depend on how many times Dr. Kavar needs to remove more margins of the tumor. It also depends how deep the tumor is in your zygomatic bone. Since the face is a sensitive and high-risk area for having any type of surgery, we may have to use skin grafts to help the wound heal, but it should not leave you with a big scar. Mohs surgery is also known for leaving a lot of the healthy skin cells so that your scar on the end will not be noticeable. But everyone that gets surgery has the potential risk of developing a keloid scar, and a keloid scar is the overgrowth of scar tissue that is raised from the skin and is discolored. If by chance you do develop a keloid scar, I can suggest an over-the-counter medicine that can put directly on the scar to help it heal correctly. So then I will move on to the wound care and the risk of the surgery. So wound care post-surgery is very important to the healing process of the wound. If you do not follow the wound care, you can develop a nasty infection. Redness, swelling, tenderness, and some of the drainage is normal and part of the risk of this surgery. If she has any questions, she can contact us directly and call me or Dr. Kavar. So then I will help her find a follow-up time to come remove the stitches. So I wrote, your stitches will need to be removed in 6 to 7 days since the wound is on your face. Today is the 20th, so how about returning on Thursday the 26th in the afternoon at 3. So then she will answer, and yeah, that was part two of treating a skin cancer patient.